Problems related to the heart are among the many causes of untimely death in the population today. Hypertension, or rather, high blood pressure, being one of them. For today's episode on Binti's Healthcare, I give you information about hypertension and ways to prevent it so as not to reach that emergency crisis. Join me. Basically, when we are talking about blood pressure, we mean the measure of the force that the heart uses to pump blood around your body, especially in the blood vessels. And it's usually measured in millimeters of mercury. Usually it has two figures. We have the systolic and the diastolic. Now, systolic pressure is that pressure when the heart pushes out blood, and diastolic pressure is the pressure when the heart rests in between the beats. An ideal blood pressure will be considered to be between 90 over 60 millimeters of mercury and 120 over 80 millimeters of mercury. Now, anything below 90 over 60 millimeters of mercury will be considered as low blood pressure. And this is usually less common unless somebody has an underlying cause like a heart failure, kidney damage, or any condition, or even dehydration. This is a topic for another day. So today I'm going to focus on mainly high blood pressure. High blood pressure is usually detected by a use of a blood pressure machine or a pressure cuff, a well-fitting pressure cuff, and it's usually a very quick and harmless technique. So in such a case where they found two readings at different days are persistently above 140 over 90 millimeters of mercury, then you will be diagnosed with hypertension. In this case, we'll be terming it as stage 2 hypertension. We have stage 1 hypertension where the readings will be ranging from 130 over 80 to 139 over 89. So the hypertension is also categorized into different stages. So depending with the severity. So what could be the factors that may predispose you to getting hypertension? We have the non-modifiable factors, those ones that we have no control over them, like aging. For example, when you're aging, there are so many processes that are changing in your body. So many organs, their function diminish, and all that. The metabolic processes also diminish. So this one may predispose you to acquiring hypertension. Then we're looking at the family history, that gene that you have. Just in case one of your parents had the heart disease, you are predisposed to that. Then we'll be looking at the race, blacks versus whites. So those are non-modifiable factors. Then we have something like you have an underlying condition. That one you have no control over it. Like now diabetes, kidney damage. When it comes to factors that we have control over them, the modifiable factors, we'll be looking at things like your diet. Diet majorly plays an important role in determining whether you're going to have non-communicable diseases or not. We'll also be looking at the physical activity. We are going to look at your lifestyle, like do you smoke or do you consume a lot of alcohol? Then we're also looking at stress management. Hypertension is a silent killer, and this is because in most cases symptoms go unnoticed, and that's why it's very important for you to have regular checkup of your blood pressure. So in those times that symptoms are seen, you will find that somebody has like a persistent headache, especially in the early morning. We'll have nosebleeds. Yes, then we have vision disturbances. Some people, you may notice that there's blood spots in their cornea or in the eyes, around the cornea or in the eyes. Then you have buzzing ears, irregular heartbeats. In severe cases, some people may have vomiting, fatigue, anxiety, chest pain, and also muscle tremors. So those are the symptoms. Just to know, when there is excessive pressure being exerted in the blood vessels, this may lead to the hardening of the arteries and therefore reducing the flow of blood. So they become constricted. The heart is going to try to pump too much blood so that it reaches all the vital organs. It may lead to heart attacks, heart failure, where the blood and the oxygen is not pumped effectively around all the body organs, it may also lead to kidney damage and eventually kidney failure, or some people may experience chest pain or what we term as angina. Then if in case it damages the brain, it may also cause stroke. So one of the strategy in preventing hypertension, we look at something we call the DASH diet. And this simply means we are going to use the dietary approaches in stopping hypertension. In such a case of the diet, you're talking about reducing your salt intake to like 5 grams per day in your meals. Excessive consumption of salt, or rather sodium chloride, has been found to lead to more fluid retention and therefore exerting more pressure on your kidneys or overworking your kidneys, which eventually may lead to high blood pressure levels. Therefore, try to reduce your salt intake by, for example, buying fresh vegetables, and just in case you want to buy those ones that are frozen or canned, choose those ones that have low sodium added or no sodium added. And if you're going to buy packaged foods or stuff, try to read your nutritional labels such that you find those ones that have been indicated low sodium or no salt added, or any sauce added. Those ones who like using table shakers, try to get those table shakers or those ones that containing salt or sauce off the table, so that you restrict your habit of adding raw salt into your foods. And when we are also looking at the diet, we focus mainly on balanced diet. Here we are going to consume foods from all the 5 food groups, and because we need the vital nutrients for the functioning of the heart muscles. And these ones, you're talking about the potassium, the magnesium, the calcium, and other micronutrients that are very vital for the whole body and for the heart. So for the whole grains or cereals, here we need to consume like 6 to 8 servings per day. So one serving is like a slice of a bread or a half cup of cooked brown rice. So we also be looking at the legumes, the nuts or the seeds, and then we focus on the meat and the meat products. Here we mainly advise on consuming lean meats or fish or poultry. Just in case you're consuming your poultry, you're going to remove that skin that has high cholesterol. So we also want to control the cholesterol levels. So look at the dairy products. We will be looking at the low fat dairy product or the skim. That's what you advise to consume. So for example, 2 to 3 servings per day. So one serving will be like 1 cup of low fat milk or skimmed milk, 1 cup of low fat yogurt, then a half ounce of cheese. Then with fats and the oils, we say we should use them sparingly. Choose those ones that are not saturated or those ones that have trans fats. So you can opt for olive oil, avocado, and all that. So it will be like 1 to 2 servings per day. Boil or grill your foods before eating. Vegetables and fruits, also 4 to 5 servings per day. All types of vegetables, whether they are raw or cooked. And then also look at the fruits. The fresh ones are more encouraged. These ones have all the antioxidants, they have all the fiber and all other nutrients that are vital for the functioning of the body. Smokers, kindly quit smoking, and for those ones who are heavy drinkers, try to reduce your alcohol intake. For men, it's supposed to be less than 2, and for women, less than 1 bottle per day. If you are stressed, try to manage your stress through exercise, which is the best tactic in managing, meditation, yoga, and all. And just to be sure that you've learned something about hypertension, kindly drop your comment at the comment section and we'll be happy to interact with you. If you're new to this channel, kindly subscribe. For those ones who are coming for the first time, thank you so much for watching until the end of this episode. Subscribe and hit the bell notification so that you don't miss out on more episodes that we are going to bring about health. My name is Jemima Egesa, clinical nutritionist, and bye bye.